Hello, this is Michael Matusis, Honorary Consultant with the Neuropsychiatry Department in the National Hospital for Neurology and Neurosurgery, and today I'm going to talk to you about medications that are used to help people with functional neurological symptoms. This session today is shorter than usual, and it's also more about information rather than about things to do and skills to develop. So I suggest that you watch this session with the next one, which is more about skills, and it's about the role of avoidance in functional neurological symptoms, or at least you watch the two sort of shortly after each other. So today I'm going to recap on the previous session that you've watched, which was the one about mood, about low mood and anxiety. I'm going to talk a little bit about the body systems, which are important on how medicines act, and I'm going to talk about the main families of medicines used in patients with functional symptoms. I'm going to talk a bit about problems with the use of medication and make some suggestions regarding homework. So, recap about mood. Low mood and anxiety are common in functional neurological symptoms, as they are in many conditions, many medical conditions that last a long time. Depressed mood usually comes about through a combination of past experiences and more recent events. And in depression, a negative thinking style becomes very sort of well worn. Negative thinking becomes very easy. So we talk about negative automatic thoughts. Catching these thoughts helps challenge the negative thoughts constructively and develop better alternatives. Gradually developing rewarding activities and dealing with problems in one's life situation are also important in dealing with negative mood and anxiety. Using a diary, as you have actually practiced by now a fair bit, is important. And in dealing with low mood and anxiety, we use cognitive-behavioural therapy style diaries. Okay, so now we come to medication and functional neurological symptoms. Let's talk a little bit about the senses of the body first, because this will become important later. Senses are body systems that respond to specific aspects of the environment, such as light, heat, and others, and respond to specific parts of the brain where the signals are received and processed, and they're given biological meaning, so that a particular object in the environment means something for the individual in terms of their survival and their function. And here's another rather complicated diagram, but we'll go through it gradually. And what I want to focus on here is how, when you have a sensation, for example, you have an injury to the hand that gives rise to pain. It mentions here a burn or injection or a chemical. This actually causes signals to travel in these nerves, which are called peripheral nerves, through the arms and legs to the spinal cord. So these are sections of the spinal cord, which is the part of the nervous system that goes up and down inside your backbone. So these signals, as you can see, go up, cross over to the other side of the body, go up the spinal cord, and then they they make a little stop, so to speak, in this part of the brain right in the middle, which is called the thalamus, and then they reach finally the outer surface of the brain, which we think is the most important part as far as providing the conscious sensation of whatever it is that the signal is about. In our case here, it is pain. Traditionally there are 5 senses which were described since ancient times by Aristotle and so on, and there's a sight, hearing, touch, smell and taste. But we have many other senses which actually are at least as important, and they are more important for functional neurological symptoms. And these include pain, balance, joint motion and acceleration, a sense of time, a perception of temperature differences, and possibly others, such as a sense of direction, and senses to do with what's going on inside the body, the stretching of the lungs or the muscles, what's going on in the skin, how much carbon dioxide there is in the blood. So, medications. Just take a second and think whether you have any questions about any medicines that you happen to be taking. I'm now turning to the types of medicines that are used in functional neurological symptoms. These kinds of medications are actually called by the names that were about the conditions where they were first used and where they were discovered. However, when it comes to functional neurological symptoms, it doesn't necessarily mean that they are treating this condition. They're called that, but they may be treating something different. So the first class here is antidepressants, and take a bit of a breath, because there is a number of sort of strange drug names coming up. We'll go through them slowly. So there are 2 classes of antidepressants. The older ones, which are called tricyclic antidepressants, and the most common one here is amitriptyline, and you may have been prescribed amitriptyline, although not for depression. And then we have some newer antidepressants, and those relate to slightly different chemicals, or they do that in a slightly different fashion. And they are specific usually for this chemical called serotonin, or at most for the chemical called serotonin and the one called noradrenaline or norepinephrine. And sometimes these are known by their initials SSRI and SNRI. And they include citalopram, fluoxetine, sertraline, and duloxetine. And then we have another class of medicines called painkillers, but neuropathic painkillers, or they are anti-epileptics. And these include amitriptyline, duloxetine, gabapentin, pregabalin, and carbamazepine. Now, I've highlighted in the same color the amitriptyline and duloxetine so as to point out to you that the same medicine is used in several different fashions. So here, duloxetine is in this category, but it's also in this category. And this is going to be a theme in what's to come. The other type of tablet which is often used in functional neurological symptoms is sleeping tablets. Many of their names start with Z, such as Zopiclone. So, realistic uses of medication. Medication rarely fixes the problem that caused the condition. Okay, most of the medicines that we use here are not really like, for example, antibiotics that kill bugs. However, medication can be helpful. It can be helpful in dampening symptoms. It improves pain conditions. It improves low mood and fatigue, which are very common in functional neurological symptoms. It reduces worry and anxiety. People, however, can get better from functional neurological symptoms without medication, and no one really should feel forced into taking tablets.